everyone. Once again, good morning, good afternoon, and good evening, and a warm welcome back to day 2 of the APPIS 2024 Summit. I'm Ruth Kuguru, and I lead communications and patient advocacy for Novartis, covering the Asia Pacific, Middle East, and Africa region. And I'm really glad to be joined today to open day 2 by my fellow APPIS 2024 Council member, Professor Sharon Hsiao.
Hi, and I'm Sharon Hsiao, Professor and Director, Graduate Institute of Clinical Pharmacy from National Taiwan University. I'm so proud to have been part of APPIS and seeing its growth from its beginning. Okay, then we will show you some slides for my APPIS experience with Taiwan. So it's been a terrific journey. In 2022, I'm serving as a speaker and then a discussion facilitator in 2023, this year, council member. So it's been a terrific journey, and I'm so glad that I can work with the Taiwan team. So here I would like to say, 谢谢大家, APPIS 台湾的伙伴们. So a warm welcome to all the patient organizations, healthcare providers, health tech companies, health policy makers who are joining us for day 2 of the APPIS Summit 2024.
Yes, indeed. I think a warm welcome to everyone. For me, the diverse healthcare stakeholders that make up APPIS community is really what makes it special, whether it's healthcare professionals, patient organizations, policymakers. I mean, all of us coming together is really what makes a difference. And it's been great to see all the photos that have come in over the last couple of days. I would just ask for you to keep sharing them because we are joining them from all over, and it's really a nice way for us to see and connect with one another, even if we're not together in the same room. So please use the APPIS virtual photo booth and let us know where you are and share your photos with us. Sharon, I don't know how you feel, but I'm really still buzzing from APPIS, the first day of APPIS yesterday. Amazing discussions. We heard from expert panel speakers and practitioners and on our 2 key themes, health literacy and health policy shaping. And I'm really looking forward to the day ahead as well. Maybe I can hand over to you to share a little bit about what's in store for today.
Yes, we will have another great lineup of speakers today who are joining us from across the world to share their valuable knowledge and experience. So today's section will be focusing on data privacy when shaping health policies and future readiness. To ensuring we are prepared to address the future needs of patients using today's latest technology and tools. In addition, we will listen to some of the participants of APPIS and share more on how you can apply for the APPIS Innovator Program 2024.
Yeah, that all sounds great. And I don't even want to take any more time. I just think we should just jump in. Yeah. So without much more introduction, I'm really excited to invite Javier Boix, who's going to kick us off today. Javier is the head of communications and patient advocacy for Novartis Innovative Medicines International. And he's going to open up the session today by talking about harnessing the power of data in healthcare. So with that, over to you, Javier.
Hello, everybody. Thank you so much, Ruth and Sharon. I'm glad to be here with all of you today. And good morning, patient leaders, healthcare providers, and every stakeholder that is spending time today with us. It's an honor to welcome all of you to today's session. My name is Javier Boix. I'm the Global Head for International Communications and Patient Advocacy at Novartis. And I'm thrilled to be here today with all of you to discuss a topic that is at the forefront of our minds, which is harnessing the power of data in healthcare. Today, I would like to take the opportunity to delve deeper into the potential of data-driven healthcare and explore the transformative impact it can have on patient outcomes, on research, and overall on the future of medicine. Data has always played a crucial role in advancing medical knowledge and improving patient care. Today, with the exponential growth of technology and the digital revolution, we now have an unprecedented opportunity to leverage data to transform healthcare in ways we could have never imagined before. By collecting and analyzing vast amounts of data, we can gain a deeper understanding of disease, identify patterns, and develop personalized treatment plans that are tailored to individual patients. This personalized or targeted approach to medicine can maximize the chances of recovery and minimize side effects, ultimately improving patient outcomes, which is what all this is about, right? It's about the patient, and it's about ensuring that we can, in this in this cross-stakeholder effort, we can all improve patient outcomes. I also want to appeal to your imagination, and I would like you to, for a second, close your eyes and imagine a world where we can predict disease before it even manifests, where we can identify those people at risk and intervene early to prevent illness. Also, you can, imagine a world where treatments are tailored to the unique genetic makeup of each patient, taking into account their specific health conditions and lifestyle factors. Well, I mean, that's just not imagination. That's just not a dream. Everything that I was describing just a second ago, is becoming a reality. In addition to personalized medicine, data can also play a significant role in accelerating medical research and development. Today, we will need to understand the story that our data is telling us, and not the other way around. It requires a shift from a knowledge culture to a learning culture. By aggregating and analyzing data from different sources, we can identify new drug targets, discover potential therapies, and expedite the drug development process. This collaborative approach can lead to breakthroughs in medical science, bringing us closer to finding cures for complex diseases. Additionally, data-driven healthcare can empower patients to take an active role in their own care, something that is actually at the forefront of our efforts as Novartis, right? Trying to empower patients to take a more active role in managing their disease and in having the right conversations with their doctors and caregivers. Wearable devices and remote monitoring technologies have made it possible to collect vast amounts of data on patients' vital signs, activity levels, and sleep patterns. By analyzing this data in real time and applying predictive analytics algorithms, healthcare providers can detect early warning signs of deteriorating health conditions, such as heart failure or respiratory distress. This allows for timely interventions and proactive management, reducing hospital readmissions and improving patient outcomes again. With access to their health data, patients can make informed decisions, track their progress, and actively participate in their treatment plans. This patient-centric approach not only improves patient satisfaction, but also leads to better health outcomes. Okay, now with all that said, I would argue that with great power comes great responsibility, right? And the use of data, leveraging data in all these different spaces and fields also poses a number of risks, right? And I wanted to highlight two of these challenges that I believe we all should be very mindful of. The first one is the importance of data protection, right? As we embrace a data-driven healthcare culture, we must also be mindful of the ethical considerations that arise. In this world, this data-driven world, we must ensure that patient privacy and data security is prioritized. Questions like, how do we build a framework that protects patient information while still allowing for the free flow of data is essential, right? And it's a type of question that all stakeholders need to think through and have an answer for. The collaboration between patient leaders, healthcare providers, and industry is vital in achieving this delicate balance. By working together, we can develop robust data governance policies that safeguard patient privacy, promote transparency, and foster trust in the healthcare system. So, in addition to the data protection challenge, we also have a digital, divide landscape, right? We must address the digital divide that exists in healthcare. While many of us have access to cutting-edge technologies and data analytics tools, there are still several communities and regions that lack access to basic healthcare structure or infrastructure. We must strive for equitable access to data-driven healthcare, ensuring that no one is left behind in this journey, right? So at the end of the day, the power of data is in healthcare is truly, truly inspiring, and there is so much potential to redefine the way we approach medicine. We transform patient care and ultimately save lives, right? So today, as we gather here, I invite you to learn from the speakers and share your experiences with others to explore innovative solutions that will improve and extend people's lives. Together, we can drive the future of healthcare where data-driven insights guide our decisions, empower our patients, and revolutionize healthcare as we know it. Thank you so much for your attention, and back to you, Ruth.
Thank you so much, Javier. I think that was a great way to start the second day of APPIS. And before we dive in, I just want to remind everybody that there's a full agenda for today's program here on the platform. And you can also find the information on the APPIS website. And I'm excited to dive into today. So I'd like to introduce our next speaker, who's Nitin Devate. Nitin is the region head of data privacy, digital and AI compliance at Novartis. And he's also covering the Asia Pacific, Middle East, and Africa, as well as our global health unit. You know, as Javier said in his opening, with the great power of data comes great responsibility. And that really tees us up very nicely for what Nitin is going to talk to us about in this next session. The title of the next part of the program is Safeguarding Your Health Data. And he's going to be talking about the evolving data protection landscape. So with that, I'd like to hand over to Nitin to get us going.